Mycophenolate mofetil, MMF, has emerged as a vital immunosuppressive therapy for organ transplant recipients. With its unique mechanism of action and unparalleled efficacy, MMF plays a crucial role in preventing rejection and ensuring the longevity of transplanted organs. By inhibiting the production of key enzymes necessary for lymphocyte proliferation, MMF intervenes in the immune system's response to foreign tissue, effectively reducing the risk of rejection. This targeted immunosuppression allows patients to maintain the delicate balance between suppressing their immune system and preserving its vital protective functions. Not only does MMF offer exceptional effectiveness in preventing rejection, but its safety profile has also been widely recognized. Its relatively low toxicity compared to other immunosuppressive agents has made MMF a preferred choice among healthcare professionals. In this video, we delve into the mechanism of action of MMF, exploring how it works at a cellular level to achieve optimal immunosuppression. Furthermore, we examine the significant role MMF plays in improving patient outcomes post-transplantation. Whether you are a healthcare provider or a patient considering transplantation, understanding the mechanism of action and benefits of MMF is imperative to making informed treatment decisions. Immunosuppression and its importance. Immunosuppression plays a crucial role in the field of organ transplantation. When a patient receives a transplanted organ, their immune system recognizes it as foreign and mounts an immune response to reject it. This immune response, if left unchecked, can lead to the failure of the transplanted organ and significant health complications for the recipient. Therefore, suppressing the immune system becomes essential to ensure the success of organ transplantation and improve patient outcomes. The goal of immunosuppression is to strike a delicate balance between reducing the risk of rejection and preserving the immune system's vital protective functions. By suppressing the immune response, the risk of rejection can be minimized, and the longevity of the transplanted organ can be maximized. Immunosuppressive therapies work by targeting specific components of the immune system, interrupting their normal functioning, and preventing the immune response against the transplanted organ. One of the key immunosuppressive agents used today is mycophenolate mofetil, MMF. With its unique mechanism of action and outstanding efficacy, MMF has revolutionized the field of transplantation. In the following sections, we will explore how MMF works in the body, its mechanism of action, clinical applications, advantages and disadvantages compared to other immunosuppressants, common side effects, dosage guidelines, and precautions to consider when using MMF. How mycophenolate mofetil works in the body. Mycophenolate mofetil belongs to a class of drugs known as selective inhibitors of inosine monophosphate dehydrogenase, IMPDH. This enzyme is crucial for the synthesis of guanosine nucleotides, which are essential for DNA replication and cell proliferation, particularly in lymphocytes. By inhibiting the activity of IMPDH, MMF disrupts the production of guanosine nucleotides in lymphocytes, leading to a reduction in their proliferation. The specific inhibition of lymphocyte proliferation is what sets MMF apart from other immunosuppressive agents. Unlike traditional immunosuppressants such as calcineurin inhibitors or corticosteroids, which suppress the immune system broadly, MMF selectively targets the lymphocytes responsible for mounting the immune response against the transplanted organ. This targeted immunosuppression allows for a more tailored approach, minimizing the risk of infection and other adverse effects associated with broad immune suppression. Furthermore, MMF has been shown to have synergistic effects when used in combination with other immunosuppressants. For example, combining MMF with calcineurin inhibitors can achieve a more effective immunosuppressive effect while minimizing the dosages of both drugs, reducing their individual toxicities. This combination therapy has become a standard practice in many transplant centers, leading to improved patient outcomes and long-term graft survival. Mechanism of action of mycophenolate mofetil. The mechanism of action of mycophenolate mofetil can be summarized in 3 key steps. First, MMF is rapidly converted to its active metabolite, mycophenolic acid, MPA, in the body. MPA is the pharmacologically active form responsible for the immunosuppressive effects of MMF. Once converted, MPA enters the cells and inhibits the activity of IMPDH, the enzyme involved in the production of guanosine nucleotides. By inhibiting IMPDH, MPA disrupts the de novo synthesis of guanosine nucleotides in lymphocytes. This leads to a reduced availability of guanosine nucleotides, which are essential for DNA replication and cell proliferation. As a result, lymphocyte proliferation is significantly impaired, preventing the immune response against the transplanted organ. Additionally, MPA has also been shown to have other immunomodulatory effects. It can inhibit the production of pro-inflammatory cytokines, such as interleukin-6, Illinois-6, and tumor necrosis factor alpha, TNF-alpha. These cytokines play a crucial role in the immune response and inflammation. By reducing their production, MPA further suppresses the immune response, aiding in the prevention of rejection. Clinical applications of mycophenolate mofetil. Mycophenolate mofetil has become a cornerstone in the immunosuppressive regimen for organ transplant recipients. Its clinical applications extend to various types of solid organ transplants, including kidney, heart, liver, and lung transplants. MMF is typically used in combination with other immunosuppressive agents, such as calcineurin inhibitors, e.g., tacrolimus or cyclosporin, and corticosteroids, to achieve optimal immunosuppression. In kidney transplantation, MMF has shown significant benefits in reducing the incidence of acute rejection and improving long-term graft survival. Studies have demonstrated that patients receiving MMF-based immunosuppression have lower rates of rejection compared to those on alternative regimens. This has translated into improved patient outcomes and increased graft survival rates. Similarly, in heart transplantation, MMF has been shown to be highly effective in preventing rejection. The combined use of MMF with calcineurin inhibitors and corticosteroids has improved patient survival rates and reduced the risk of acute rejection. MMF has also been used successfully in liver and lung transplantation, further highlighting its versatile applications in the field of transplantation. Advantages and disadvantages of mycophenolate mofetil over other immunosuppressants. Mycophenolate mofetil offers several advantages over other immunosuppressive agents commonly used in transplantation. One of the main advantages is its relatively low toxicity compared to alternative therapies. While other immunosuppressants, such as calcineurin inhibitors, can cause significant toxicities, MMF has a more favorable safety profile. This makes it an attractive option, especially for long-term use in transplant recipients. Another advantage of MMF is its selective mechanism of action. By specifically targeting lymphocyte proliferation, MMF reduces the risk of broad immune suppression. This targeted immunosuppression allows patients to maintain some level of immune function, reducing the susceptibility to infections and other adverse effects associated with potent immunosuppression. However, like any medication, MMF is not without its disadvantages. One of the potential drawbacks of MMF is its cost. Compared to some older immunosuppressants, MMF can be relatively expensive, making it less accessible in certain healthcare systems or for patients without adequate insurance coverage. Cost considerations should be taken into account when deciding on the most appropriate immunosuppressive regimen for individual patients. Common side effects of mycophenolate mofetil. While MMF generally has a favorable safety profile, it is not without side effects. Common side effects of MMF include gastrointestinal symptoms such as nausea, vomiting, diarrhea, and abdominal pain. These side effects can be dose-related and may improve over time or with dose adjustments. In some cases, the use of enteric-coated formulations or mycophenolate sodium, an alternative formulation, may help mitigate gastrointestinal side effects. MMF can also cause hematologic abnormalities, such as leukopenia, reduced white blood cell count, and anemia, reduced red blood cell count. Regular monitoring of blood counts is necessary to detect these abnormalities early and adjust the MMF dosage accordingly. In some cases, the use of a reduced MMF dose or switching to an alternative immunosuppressant may be necessary to manage these side effects. Additionally, MMF may increase the risk of infections due to its immunosuppressive effects. Patients receiving MMF should be closely monitored for signs of infection and receive appropriate prophylaxis when necessary. It is crucial to strike a balance between immunosuppression and the risk of infection to ensure optimal patient outcomes. Dosage and administration guidelines for mycophenolate mofetil. The dosage and administration of mycophenolate mofetil may vary depending on the type of transplantation and individual patient factors. Typically, the initial dose of MMF is based on the patient's body weight and renal function. Regular monitoring of blood levels and adjustment of the MMF dose may be necessary to maintain optimal immunosuppression while minimizing side effects. MMF is usually administered orally as tablets or capsules. It is essential to follow the prescribed dosing schedule and take the medication consistently to ensure its effectiveness. Missing doses or taking the medication irregularly can lead to suboptimal immunosuppression and increase the risk of rejection. In some cases, patients may have difficulty tolerating oral MMF due to gastrointestinal side effects. In these situations, alternative formulations such as mycophenolate sodium or enteric-coated formulations may be considered. These formulations can help reduce gastrointestinal side effects and improve patient adherence to the medication regimen. Precautions and considerations when using mycophenolate mofetil. When using mycophenolate mofetil, several precautions and considerations should be taken into account. First, MMF is contraindicated in patients with known hypersensitivity to MMF, MPA, or any of its components. Patients with severe gastrointestinal disorders should also exercise caution when using MMF, as it can exacerbate these conditions. Furthermore, MMF has been associated with an increased risk of congenital malformations and spontaneous abortions when used during pregnancy. Female patients of childbearing age should be counseled on the potential risks and the need for effective contraception during MMF therapy. Additionally, male patients should also be informed about the potential risk of MMF in fathering a child with birth defects. Close monitoring of renal function is essential when using MMF, as it can cause renal toxicity in some patients. Regular assessment of renal function and adjustment of the MMF dosage may be necessary to prevent renal dysfunction and optimize patient outcomes. Conclusion and future prospects of mycophenolate mofetil in IMMUNOSUPPRESSION. Mycophenolate mofetil has revolutionized the field of transplantation with its unique mechanism of action and outstanding efficacy. By selectively targeting lymphocyte proliferation, MMF plays a crucial role in preventing rejection and ensuring the longevity of transplanted organs. Its relatively low toxicity compared to other immunosuppressive agents and synergistic effects when used in combination therapies have made MMF a preferred choice among healthcare professionals. While MMF has its advantages, it is essential to consider the potential side effects, dosage guidelines, and precautions associated with its use. Regular monitoring of patients receiving MMF and close collaboration between healthcare providers and patients are necessary to ensure optimal immunosuppression, manage side effects, and improve patient outcomes. As the field of transplantation continues to evolve, ongoing research is focused on further understanding the mechanism of action of MMF and exploring new formulations or alternative immunosuppressive agents that can enhance its efficacy and safety profile. By continually advancing our knowledge and refining our approaches to immunosuppression, we can strive to improve transplant outcomes and offer better quality of life for organ transplant recipients. Thanks for watching.